The alarming rise in prostate cancer rates in the United States over the past decade has raised significant concerns among health professionals and the public alike. According to a recent report from the American Cancer Society, ACS, there has been a notable increase in the number of prostate cancer cases, particularly those diagnosed at advanced stages. This trend is particularly troubling, as it suggests that more men are facing severe health challenges related to this disease. Starting in 2014, the annual rate of prostate cancer diagnoses has surged by 3%, reversing a previous decline of 6.4% per year that occurred during the preceding decade. This information comes from the ACS's annual statistics report on prostate cancer, which highlights a concerning shift in the landscape of this common illness. The most significant increases have been observed in advanced stage prostate cancer, which has escalated by as much as 6.2% each year, with variations noted across different age groups. In addition to the rising incidence of prostate cancer, the report indicates that the rate of mortality from this disease has seen a slowdown in its decline. While death rates had been decreasing by 3% to 4% annually during the 1990s and 2000s, this reduction has now dwindled to just 0.6% per year over the last 10 years. This stagnation in mortality rates raises questions about the effectiveness of current screening and treatment strategies. A pivotal moment in this trend can be traced back to the early 2010s, when the U.S. Preventive Services Task Force recommended against routine prostate-specific antigen PSA screening. Following this guidance, there has been a noticeable uptick in the diagnosis of advanced-stage prostate cancer, suggesting a direct correlation between reduced screening and increased severity of diagnoses. Dr. Arif Kamal, an oncologist and chief patient officer at the ACS, pointed out an intriguing anomaly. We actually see PSA testing this decade versus the previous decade going down, so the incidence of prostate cancer is going up despite less testing occurring, which is an interesting anomaly. This observation hints at the possibility that other factors, be they environmental, nutritional, or otherwise, may be influencing the rising rates of prostate cancer, factors that we do not yet fully comprehend. PSA testing is crucial for early detection, which can lead to better outcomes and survival rates. However, the report also suggests that the routine use of PSA testing may have led to overdiagnosis in the past. Now, as efforts are made to curb overdiagnosis, we may inadvertently be contributing to the increase in advanced stage cases, according to Dr. Kamal. For men aged 45 and older, it is essential to engage in discussions with healthcare providers about the appropriate timing for prostate cancer screening. While some doctors may advise against testing, many men could benefit from having a structured testing plan in place. In light of these findings, the ACS has proposed federal legislation aimed at eliminating cost-sharing requirements, such as deductibles and copayments, for prostate cancer screening tests, specifically for men at high risk of developing the disease. This initiative could potentially increase access to vital screening services. The report also highlights stark disparities in prostate cancer mortality rates among different racial and ethnic groups. For instance, Black men face death rates from prostate cancer that are double those of any other racial or ethnic demographic. Additionally, Native American men experience a 12% higher mortality rate from prostate cancer compared to white men, despite having a 13% lower incidence of the disease. Dr. Kamal emphasized the need for a tailored approach to risk management and screening, stating, "Oftentimes, we might think of a one-size-fits-all approach to how we manage risk and how we have these conversations. But certainly, if we know that certain populations based on their backgrounds may have higher mortality, it might change our threshold for the testing we do, the urgency by which we do it, and the frequency by which we do it." Prostate cancer remains the most frequently diagnosed cancer among men in the U.S., accounting for a staggering 30% of all male cancer cases projected for 2025. It is also the second leading cause of cancer-related deaths in men, following lung cancer. Dr. Kamal noted that discussions surrounding PSA testing often lead to broader conversations about a man's overall health history, which can be crucial for comprehensive care. He remarked, "Men generally don't like coming to the doctor, and so this gave a focal point to have a conversation about prostate health, but also things beyond that." As we navigate these complex issues surrounding prostate cancer, it's essential to consider the implications of screening practices and the disparities in health outcomes. What are your thoughts on the current recommendations for prostate cancer screening? Do you believe that the benefits of PSA testing outweigh the risks of overdiagnosis? We invite you to share your opinions and experiences in the comments below.